Well, if you were driving on the Langevin Bridge into downtown last night, you may have noticed it turned green. The reason behind the light color change? To get people talking about Lyme disease, which is spread through tick bites. As Carolyn Curry de Castillo reports, a new organization has been set up in Alberta to raise awareness about what some say is a growing health concern.
In 2007, Susan McInnes was training for her first Mother's Day 10K run, but all her plans crashed when she developed chronic fatigue, aching joints, ultimately unable to walk.
My body was falling apart, and just quickly I was just struck down. Something just like a switch was flicked, and I just went down, down, down.
After years of seeing various specialists and her condition worsening, Susan got blood tests done in California that showed she had Lyme disease.
But I couldn't find a doctor here that had enough information about it to diagnose me and to treat me. So I had to leave the country.
The Public Health Agency of Canada says recent studies suggest that the incidence of Lyme disease in Canada is increasing. Now a new organization has been set up in Alberta to help those who may be suffering from the disease.
So I feel the organization is really needed in Alberta. There's nowhere for patients to go. Patients can come to bring the patients together, stand united, and let people know that Lyme disease is here.
This is a very common story that nobody listens to you, and so I wanted to be there for other people.
Rebecca Risk says she first contracted Lyme disease after being bitten by ticks near Regina as a teenager. It wasn't until she was 30 years old that she was diagnosed. Now the Calgary Doctor of Chinese Medicine treats others who may have Lyme disease.
Makes you feel like you're crazy, and then when I finally got the diagnosis, it was a relief because I knew what it was finally, because I knew there was something wrong and no one believed it. And so, I mean, that's one of the reasons why this has become such a passion for me, and I do so much for my clients because I understand how they feel. I know that they feel very lost and confused.
Susan has been on antibiotics for 3 years to control her symptoms, which she says have improved dramatically. But treatments for chronic Lyme disease remain controversial. Her new group will push for more scientific studies in the hopes that people can be more quickly diagnosed and treated. Carolyn Curry de Castillo, Global News.
The Lyme Disease Association of Alberta will have their first meeting this Wednesday at the Strathcona Community Association. The Green Party of Canada is also hoping to pass a private members bill calling for a new national strategy for Lyme disease.